Hello and welcome to Sick Notes. My name's Ed Hope. I'm a junior doctor and a teaching fellow in the UK, and on this channel we take a look at medical things and explain them in simple terms. So if that sounds good, then why not join our community here on YouTube? I previously looked at a bunch of the Marvel movies, looked at all the movies in phase 1 of the MCU, and you guys seem to really enjoy it. So we're back with phase 2. So let's see how Tony Stark's been getting on in Iron Man 3.
I thought that was just a theory.
Well, it was. If I'm right, we can access the area of the brain that governs repair.
Wow.
And chemically recode it.
That's incredible. Essentially, you're hacking into the genetic operating
Operating
system.
So there's no part of your brain that looks after repair. That happens very much at a tissue level. So within the cells, kind of kicked off by a process called inflammation. So say you fall over and you get an abrasion on your hand, the cells in that area would be damaged and so would release chemical messengers called cytokines, cyto meaning cell, and kine coming from kinetic meaning movement, because these draw and attract immune cells to the area. These cytokines also cause your blood vessels to dilate and also for the blood vessels to become more leaky, both of which means these things mean more blood flow go to that area, and therefore more immune cells can help kind of destroy the infection there and promote healing. This is the process of inflammation, and this kind of rush of immune cells and fluid from the blood is why the area, when we get an abrasion, will become very red, hot and swollen, kind of the hallmarks of inflammation. The nervous system does have a role, however, in protecting that area, because another hallmark of inflammation is pain. The inflammatory response stimulates the nerves because our body doesn't want us to use the damaged area, so that further helps to promote its recovery.
I'm calling it extremis. Well, it's human application. Exactly. Dendritic revitalization, disease prevention, even limb regrowth.
Dendritic revitalization. I'm pretty sure they've picked that jargon because it sounds really cool. But this could mean better healing in terms of dealing with infections better, because the dendritic cell they mention is a white blood cell and part of the adaptive immune response. So how our immune system gets better with dealing with infections the more it sees them. They also mention limb regrowth. So although inflammation enables us to repair at a cellular level, it does not have the organization to regrow things on a tissue level. As we know, because if we have a sort of large cut, then we tend to get a scar. It doesn't heal perfectly. Or if we lose a finger, the finger doesn't grow back. My mind is drawn to Kurt Connors, the evil guy in The Amazing Spider-Man, who tried to emulate lizards like salamanders who are able to regrow their limbs. Like our salamanders have an inflammatory reaction, but their macrophages, another type of white blood cell, attract to the area stem cells, which are cells that are able to get around this problem of tissue organization as they're able to change into any cell. As you can imagine, there are a great deal of research into stem cells for a range of conditions. Everything from, the regrowing limbs to spinal cord injuries to growing new heart tissue for people that have had heart attacks. So although this currently is science fiction, we could start seeing major developments in our lifetime.
Now, pinch my arm. I can take it. Pinch me.
What is that?
Primary somatosensory cortex. It's the brain's pain center.
What a little smoothie. So the brain's pain center, yeah, sort of. So the primary somatosensory cortex, let's break it down. So somato is when we refer to the skin and muscles and soft tissues of the body. Sensory meaning nerves traveling from the body to the brain. So in this context, they're collecting information picked up by our skin and muscles. And cortex is the outer part of our brain. So the somatosensory cortex is an area in the outer part of the brain that is responsible for all the sensation from our skin and muscles. So the smoothie here is Killian, the bad guy in the movie, and his plan is to create some superhumans. Him calling it the pain center here, clearly he's simplifying things, which is fine. Many of the concepts that we explain to patients and even that we use to practice medicine are much more complex when we boil things down. But the perception of pain is a super complex thing using multiple pathways in the brain. And a major one of them would be the primary somatosensory cortex, as laid out here. That's totally accurate. But let's go in a bit more detail. So if we take our example here that Killian's been pinched on the arm, the pain impulse would travel through the peripheral nerves to the spinal cord. And then they'd actually cross over to go to the brain. So the pain felt in your left hand would actually be felt by the right side of the brain. These signals would then travel into the thalamus, which is an egg-shaped area deep in the brain made of densely packed brain cells. That acts as a kind of relay to process where all the signals from the body should go. So when receiving these pain signals, the thalamus would direct them up to the cortex, the upper part of the brain we talked about, where the actual pain signal is analysed. So how intense the pain is, where it's coming from, and also trying to figure out exactly what it is. So this is all in the somatosensory cortex, as we mentioned. But the thalamus also sends signals to other areas like the limbic system, the area responsible for emotion. So having pain gives you an emotional response. As we probably know, it might make you quite angry if you're experiencing pain. It also sends signals to the autonomic part of the body, so it will increase your heart rate and also might make you feel quite sick. And finally, the pain signals would also just stimulate the whole brain as well, making you more alert. So although the somatosensory cortex may be described as the pain center, there are many other centers involved in the pain response.
Extremis harnesses our bioelectrical potential, and it goes here. This is essentially an empty slot, and what this tells us
Is that our mind, our entire DNA, in fact, is destined to be upgraded.
So we were just about clinging on to reality in the previous stuff, but I think now we've definitely let go with this kind of upgradable slot within our brains. Clearly we don't have this kind of USB slot available to upgrade our brain. This kind of reminds me of the idea that we only use 10% of our brains or something like that. Again, this is not true. If we were to use 100% of our brain, you'd be having a generalized seizure, because everything would be stimulated and there'd be no meaning or no pattern to the circuit. The whole function of your brain is it's a series of networks that rely on sometimes being activated and sometimes not in order to process things. Therefore, I think this bit is much more about setting the scale of Killian's research rather than how actually they plan to make the superhumans. But they do mention something here which could work.
Is that our mind, our entire DNA, in fact, is destined to be upgraded.
Altering the DNA. So although upgrading our brain is not going to give us superhuman healing powers, because as we mentioned, the repair happens at a cellular level, the idea of upgrading our entire DNA, the instructions that make a cell, this is much more within the realms of possibility.
Imagine if you could hack into the hard drive of any living organism and recode its DNA.
It would be incredible.
So exactly what they say here, really. And we can do this type of thing now called gene therapy. Lots of research going on to this area, so it might not be science fiction for too long. And my first thought would be in treating diseases, not worrying about superhuman weapons like pepper pot things.
Unfortunately, to my ears, it also sounds highly weaponizable, as in enhanced soldiers.
I think it's far easier to fix a faulty gene because we know what the working one should be and transferring that in rather than introducing what would need a series of genes to make someone some kind of super soldier. So gene therapy is a term we use for changing someone's DNA in order to treat a disease. The procedure tends to involve using a modified virus to insert a gene which corrects a defective gene. A virus is not a living thing, it's a little biological machine in a protein jacket that invades our cells with its own genetic material. So if we're able to hijack the virus's ability to insert DNA into cells, then we can use it to repair faulty genes. An example of this would be using a virus to insert the clotting factor 8 gene into patients with haemophilia A. These patients have no factor 8, so their blood does not clot, meaning they're likely to bleed a lot. But if we correct the gene, they're able to make factor 8, they won't have their symptoms. So this concept of modifying DNA, it totally holds up. And later on, we see the impacts of the superhuman gene therapy. They've created these super hot humans. So the genes in the DNA would have been altered, probably to have this increased metabolism, so to be able to heal faster, to be able to be stronger, and to produce this kind of heat-like superpower. I don't think our bodies, even with all the kind of gene therapy, would ever be able to get as extreme changes as we see in this movie. And the fire breathing thing, I was thinking the only flammable substance that your body really creates usually comes out the other hole.
Help me!
Your body would not be able to handle the extreme temperature very well. I mean, I didn't think it would be quite so dramatic. But we see another blast injury. We've seen a few of these in our Marvel movies so far. So Happy would be getting a primary blast injury from the shock. Also a secondary blast injury from the shrapnel being thrown at him. And we don't really see the tertiary blast injury, so it doesn't look like he's been thrown from the blast. So I don't think he's had any injury from that in this case. So we see Happy Hogan has ended up in hospital due to the blast injuries, and is probably also suffering from a quaternary blast injury. Yes, there is one more. So anything that could be after the blast. So we could have some smoke inhalation, some problems with burns, some complications with infection from the shrapnel, things like that. That would all come within that bracket. We see here that he's unconscious, so this may be due to the injuries directly affecting his brain, or I think more likely in this scenario it is artificially done, because the smoke inhalation and the noxious particles can directly injure the lung, meaning we would require mechanical ventilation. So we'd have to put him under sedation so that he'd be able to tolerate having the tube down his throat, as we can see here. And looking at the shot here, we can see the ventilation machine on his left with its characteristic wave. Around the bed, we also see plenty of fluids, and with that a pump to push the fluids in, and also a patient-controlled analgesia device, a PCA. So breaking these down, obviously if you're unconscious you can't drink, and you need around 2 to 3 litres of fluid a day, as well as other various salts and sugars and things like that. So the fluids will be directly replaced into the vein. There would also be a catheter as well in the bladder too. Not too glamorous, so that's probably why they didn't show that. And finally, the PCA, the patient-controlled analgesia, that's this module here. So that would contain a syringe, usually of something like morphine, to help reduce pain. That's what we mean by the term analgesia. And it has this kind of keypad here that stops anyone sort of stealing the drug. And the patient would have a kind of button, and when they press it, it delivers the pain relief to them, and it will have a time lock so you can't just keep getting loads and loads of morphine. Happy wouldn't be using this method at the moment because obviously he's unconscious, so you need to be awake to actually be able to use it. But I guess that's just there because when he does wake up, it's a very effective method of controlling people's pain. We saw in the first movie that Tony had a hostile takeover attempt on his company, with the board claiming he had post-traumatic stress disorder, and I didn't think there was enough evidence for a diagnosis in that film. So it was more of a kind of malicious attempt by the board to discredit him. However, in this movie, we see much more serious mental health problems. First we hear about it is that he's been awake for 72 hours.
Sir, may I remind you that you've been awake for nearly 72 hours?
So lack of sleep can be both a symptom and an exacerbating factor in mental health conditions. The most obvious symptom we see in this film is several panic attacks. The first one whilst in a cafe, brought on by remembering New York. Jarvis assesses him in the suit and confirms his heart and brain are fine, and diagnoses a severe anxiety attack. Anxiety is a very common condition and can cover a wide variety of presentations. You may know someone that suffers from it. It can have a huge impact on people's lives, and these can be anything from a generalized anxiety disorder, so occurs in a wide range of situations, to specific anxiety such as agoraphobia, being afraid of being in open and public spaces. Tony appears to be displaying a panic disorder. This is where the anxiety presents mainly as a repeated, sudden and unexpected panic attacks. Symptoms often mimic physical health conditions, You know, classical things being like difficulty in breathing, palpitations, chest tightness, sweating, a fast heart rate. And the more you notice it, the worse it gets. And people can often feel like they might be about to die. So it's very common for people with panic attacks to present to doctors worried about conditions like heart attacks and things like that. And on testing, there'll be no evidence of any kind of physical condition like we saw Jarvis gave Tony the once over here.
Check the heart, is it the brain?
No sign of cardiac anomaly or unusual brain activity.
Often people can get into avoidance behaviors where they try to avoid situations which trigger their panic.
You know what this crater reminds me of?
No idea. I don't care.
That giant wormhole in New York. Does it remind you?
That's manipulative. I don't want to talk about it.
Having said that, it's important to rule out other causes of anxiety which would trump a diagnosis of panic disorder. The most important one in this context would be PTSD, which if present would, as a diagnosis, would take precedence over panic disorder. So looking back at the PTSD guidelines from Ironman 1, he has had a traumatic event. In this instance, the events in New York from the Avengers are the clear trigger.
Nothing's been the same since New York.
Oh, really? Well, I didn't notice that at all.
You experience things, and then they're over and you still can't explain them.
He does get upsetting dreams and flashbacks. And in this film, we definitely see some avoidance behavior because he avoids talking about the subject several times.
Oh, God, that kid.
Tony? Are you having another attack? I didn't even mention New York.
Right, and then you just said it by name while denying having said it.
And I suspect he has fear and this feeling of being detached and an inability to feel happy.
Sorry. I'm a piping hot mess.
And he definitely has this aggressive, impulsive behavior.
That's what you wanted, right?
Clearly, on a couple of occasions, mentions the difficulty sleeping.
Honey, I can't sleep.
And his symptoms have been longer than 1 month and are clearly affecting his life. And also, we need to rule out it's not due to any medical illness or substance misuse. So I'm assuming his palladium toxicity from Iron Man 2 has resolved here, and the kind of large amounts of alcohol he was drinking in Iron Man 1 has stopped. We need to exclude those things before we can make a diagnosis. And I therefore believe that in this film, Tony Stark is experiencing PTSD as laid out by the DSM-5 criteria.
Do you have medication?
Nope.
Do you need to be on it?
Probably.
Do you have PTSD?
I don't think so.
I do. I think the kid is absolutely right. At medical school, one of the ways we're taught to understand the causes of mental health problems is the biopsychosocial model. I've mentioned it on the channel a few times. We're all at different risks of developing mental health problems based on our biology. So some people are more likely because of their genetic makeup. Our psychology, so you may have had a difficult upbringing or something like traumatic in your life, such as something that could trigger PTSD. And finally, our social background, so we might live in poverty or have addiction problems or family stresses and things like that. So understanding these causes means we can have management that addresses all these things, and that's important for a doctor, right? The answer isn't always just to throw antidepressants at people. That will only work on the biology. People may need things like talking therapies or help from addiction. And in Tony's case here, we see this because the end credit scene, we see Bruce Banner here give some informal counseling.
Share all my intimate thoughts, my experiences with someone. It just cuts the weight of it in half. You know, it's like a snake swallowing its own tail. Everything comes full circle. And the fact that you've been able to help me process
not the most attentive way. So that's helping the psychological problems that Tony's got. And we also get some great advice from the kid in this movie.
You're a mechanic, right?
Right.
You said so.
Yes, I did.
Why don't you just build something?
In World War II, when many soldiers came back with a form of PTSD due to the conditions they had to serve and the things they saw, although at the time the term PTSD didn't exist, it was named shell shock because people thought it was caused by the shock of explosions. And we didn't really know how to treat this. You know, we tried locking the soldiers up in kind of mental asylums, and, you know, things just got worse until a chap called Arthur Hurst tried to actually understand the condition. He knew the horror that the soldiers had seen, being an army general himself. So figured the condition was down to feeling unsafe and a kind of moral injury from everything they've seen. So all he did was create a haven for people. He let the soldiers work on the farm, do exercises, even organise dances for them to attend, essentially showing the mind and body that everything is okay. And his recovery rate was like 90%. So when we see the kid here saying to Tony, "You're a mechanic, just build something," you know, that's probably the type of therapy he needs.
As promised, I got Pepper sorted out, took some tinkering, but then I thought to myself, why stop there?
So we see them de-sterilizing themselves when they're scrubbed in. So we saw this in Doctor Strange, didn't we? So the mask and your hat are not considered sterile, so you shouldn't be touching them with your gloves and your gown. And we see Tony undergoing heart surgery to remove the shrapnel. I always thought this sounded like the simplest way to get rid of it in the first place, rather than have this complex electromagnet permanently pulling the shrapnel away. So I'm pleased he's finally getting it done. I think maybe it's because he hated doctors so much, what we learned about from the first movie. What doesn't look quite right about this scene is that we'd use a sterile drape that went over the whole patient and only exposed the area that we were immediately operating on, again to reduce the chance of infection from any of the exposed skin. Although clearly this wouldn't look anywhere near as good with a drape covering the whole thing. You wouldn't be able to see him, so that's clearly why they've made that decision. It would just ruin the whole shot. So there you have it, my thoughts of Iron Man 3, and it's been great revisiting it, particularly after Endgame and seeing the journey of Iron Man. And this was great to see the little kid as well that we see at you know, that scene in Endgame. I do hope you've enjoyed the video and maybe even learned something along the way. If there's anything that you thought of or extending on stuff I've talked about, leave a comment down below, because I know I love reading them, but everyone else, I think, on the previous videos loved chipping in with ideas as well, which is great to see. And if you did like this video, then why don't you literally like the video? That helps me figure out what stuff I'm gonna do next. And if you did enjoy this series, then why not subscribe as well? And as always, thank you to you guys for your continued support on the channel. You know, I couldn't do it without you, so thank you so much. And so until next time, I'll see you soon.